My name is Stephen Pan. I'm a Fulbright Post-Doctoral Scholar at National Dong Hwa University in Hualien. In collaboration with some Taiwanese partners, we looked at basically why is it that indigenous folks in Taiwan are more likely to die of unintentional injury. Just overall, indigenous populations in Taiwan are about 2 to 3 times more likely to die of unintentional injuries such as drownings or car crashes. We tried to try to understand that. I made some field visits to some indigenous tribes along the eastern side of Taiwan, and also am conducting a systematic review with some Taiwanese graduate students. I also analyzed about 13 years of unintentional injury data in Taiwan among the indigenous populations to look at trends, how the death rate due to unintentional injuries have just fluctuated over the years. From these data, we're hoping to publish about 2 or 3 publications in English, and also to share them through presentations throughout Taiwan. I think it's probably good to point out that although my Fulbright is ending now, I'll still be in Taiwan for another 4 months or so. From my field visits, it helped me to just gain an idea of really what the concerns are and how folks in indigenous communities see the issue of unintentional injury. And it helped me to understand that, for instance, enforcement of certain laws may be more difficult to implement in certain areas when, well, the police officer is just your next door neighbor. One of the findings was that indigenous populations are more likely to use riskier modes of transport. If you look at the per distance traveled, you're about 30 times more likely to die traveling on a motorcycle compared to a car. And so indigenous folks are more likely to use motorcycles. Another one is simply living in more remote areas that are more removed from medical care. Regardless of whether you're indigenous or not, just more likely to die en route to obtaining that care. Well, I think at a very practical level, unintentional injuries among indigenous population is not specific to Taiwan. Many indigenous populations around the world have similar trends. That is, in the US, for example, Native Americans have a much higher rate of unintentional injury death rate. And so ideally, findings from the systematic review and from the trend analysis of these interventions that are being implemented in Taiwan can be translated and inform some of the policies, public health policies in the US. My earlier goal of just trying to promote some more indigenous health research in Taiwan, I'd really encourage the colleagues who I meet back home to look into that kind of possibilities there. I think that the indigenous community here is doing a lot of really interesting and incredible work, and there's a lot of room for growth there, I feel, which is why I'm here, you know.